arteries larger because we're pumping all the blood out of your body and putting it through this machine and putting it back in the other way. So the amount of blood is, in order to do it in 5 to 6 hours, it needs to be done fairly quickly. That's very quick. So what we do is we go inside and get one of the arteries in your arm, usually it's in your arm, and we put something in it like a fine, like a tubing. And this thing is going to get bigger and bigger as the weeks go by. It has to get this thick. This is why you may see people on dialysis that their arms have all these lumps in it. They look really, really weird. Most people cover themselves, but they have these twisted veins, like they're like this thick, and that's the fistula. We call it a fistula. So we make this inside. We reconnect some things in there to make this fistula. So we're able to pump things out and in just as quickly.
You took out the blood.
In order to take out all the blood. All the blood gets taken, not at the same time, of course, because you'll die. So you have a heart attack. So it has to be done through the machine, and that's why it takes 5 to 6 hours to do it through the whole system. And so the fistulas don't work for long periods of time. These fistulas get damaged. They get blocked. So a lot of times we have to change them and then try someplace else. Eventually you end up, there's only a few places you can do this in. So you end up not having a place to use. We can use your neck if we have to. In emergencies, we use your chest right here. But this is the aorta. We don't want that because it's too dangerous. And if you get an infection, they get a lot of infections inside. Because this constant putting needles in and needles out, eventually some of the natural bacteria in your skin is going to get to it. And you end up with infections. So that's why people don't last too long on dialysis. Usually no more than 15 years. We can do a kidney transplant. Kidney transplants are pretty easy to do. The hard part is getting a kidney. The waiting lists are long. And unless you have a donor, somebody that is willing to give you a kidney.
So if you get a transplant, then you don't need a
Exactly. You don't need dialysis anymore. Sorry? You can also your kidneys can get damaged not only from diabetes, because diabetes, the sugar, damages all the tissue and all the filters inside the kidneys. But also, one of the things that happens, I lost my train of thought. The kidneys, the sugar, high blood pressure. High blood pressure. High blood pressure also can do a job on the kidneys because when you have high blood pressure, your body is like if it was always running, so your heart is always like running. That's how it is inside when you have high blood pressure. So the kidneys are also pumping as fast too. Your blood is pumping that fast. So your kidneys can get damaged from the pressure. And the pressure inside gets ruined. And the filters get ruined.
I am a very salty person. I like salty.
I mean, as long as you don't develop high blood pressure, you're fine.
No.
But, a lot of times people think that if they eat a lot of sugar, they'll become diabetic. That's not true.
No.
If you eat a lot of salt, you won't have high blood pressure. That's not true. But it's mostly once you get these diseases that you cannot use these things because then it is true. And high blood pressure runs into families. Diabetes runs in families. So if you have a family member that has diabetes, the chances of your mom has diabetes, your chances are a little more than 50% that you can get it. So we can live with just one kidney perfectly fine. You cannot run marathons, but you can be with one kidney perfectly fine. And when I say you cannot run marathons, it's because when you run, people who are runners, you're actually sweating a great deal and you putting a lot of pressure on your kidneys. If you have 2 healthy kidneys, no big deal. But if you only have 1, you don't want to mess with it. You don't want to overwork it. There's also a disease that's called polycystic kidney disease. This disease is a disease, is the presence of multiple cysts This could also be a genetic abnormality that may cause death in the first year of life. Polycystic kidney disease is definitely a congenital. We know it runs in families. These congenital cysts enlarge, which may cause high blood pressure and eventually kidney failure. Half the people with this problem require dialysis. So, depending on how bad the polycystic kidney disease is, some babies don't last too long. But if you survived, your disease may not be too bad, and eventually, as you get older, it is going to get worse. Sometimes I found a lot of people start having high blood pressure in their early 20s, and all of a sudden they're running into high blood pressure, and they don't know why. And I mean, they're too young to be, and they're not heavy, and they're too young to have high blood pressure. So a lot of times then we do a polycystic test, and we do an ultrasound to see if they have cysts inside. And a lot of times it's because they did have this disease, but they didn't know they had it, and it wasn't too bad at the beginning of their life, but now the cysts are blocking the kidneys. Yes?
Besides, sorry.
Yeah?
I have a niece, she's 23 years old, and she's working high blood pressure. And that comes out, with my sister, since she was a little girl, very bad disease, very bad, always go.
And she should get an ultrasound of her kidneys to make sure she doesn't have cysts.
23 years old.
She's too young.
But
Very
how's
young.
the insurance cover though? I mean, like, I encountered some like 18 years old, as young as 18 years old, where you have high blood pressure, but the doctor is not doing, they're not ordering ultrasounds for the kidneys. Like, do you, I mean, like, what's the reason? Do you think they don't know, or they just like?
No, they know, but a lot of times, I would say patients need to really arm themselves with information. To be 18 years old, unless they're overweight,
Yeah, it's not
You know,
very,
if they-
very fit kids.
if they're not overweight, then that's not normal.
Exercise, eat healthy, like, he's very healthy.
And it's really important for patients to figure out, sometimes to look information up, why people have high blood pressure. And it could be that he has cysts, it could be, because that's one of the most common things, that you could have some sort of abnormal cyst, or an abnormality in some of his hormones also. And he needs to look all this up, or his mother, or somebody needs to help them with that, because they need just to be on the safe side.
Yeah.
Yeah, definitely. Kidney stones are also very common problems, but they're not dangerous. They're painful, but usually it's just accumulation of like minerals in the kidney, because the kidneys, we humans produce every mineral that exists out there. If you have somebody who has gallbladder disease, when we actually clean we can put tubes down in the belly and remove all the vial. What comes out sometimes is this thing that looks like algae. And if you grab it and touch it, it's just like algae. It's a plant. And we produce it. And we produce real stones. If we test the stones, sometimes when you pass a stone, they give you a little hat so that you can put the stone in when you pass it. So they ask you to urinate in that with that little hat all the time, because they want you to bring either the dust of the stone or the stone, because then we test the stone. The stone could be simply because lack of water, or it could be that you're producing too much calcium in your system, and there's a hormonal disbalance, and that you're producing these stones because something is wrong with your body. So what they do is they give you medicine to stop producing, whether it's calcium or anything similar to that, or potassiums, so that you don't produce the stones. So sometimes it's because of a medical problem, sometimes it's simply the lack of water in the body and too much synthetic stuff that they're eating and not enough fluid. Your kidneys need fluid in order to work. And I mean water. By fluid, I mean water. So if you don't have enough fluid, you can live I mean, I know that some people don't drink water at all. I'm one of those. I hate water. And all my life, and I always suffer because of that. I had problems with my kidneys before that when I was younger. And once I started drinking water, never again had issues. But drinking water is really important. It not only does it help your kidneys, but it helps your skin. It helps a whole bunch of other issues also that we need. Diabetes also causes a great deal of damage to the kidney function. Needing dialysis, again, this damages the filters. Like any tissue, it will damage the filters. Once the filters are damaged and the kidneys are not able to produce any of these minerals in cleaning anything out, then all the toxins stay in. Sometimes when somebody's very ill, maybe they have some sort of cancer or something in their own dialysis, one of the things that we do is that the family makes a choice and we stop dialysis. Because if we stop dialysis, we know that they're going to pass away fairly soon. And if they wait to die from the cancer, it may be weeks before they die from the cancer. So sometimes family or the patient may decide to just stop the dialysis because basically they'll get very confused, they'll fall asleep, and eventually they get nauseous, and we can give them medicine for that. They get confused and sleepy, and they just stay there. That's it. And in a few days, 4 or 5 days maximum, they will die. Urinary tract infections are also common, especially for women who are diabetic. Diabetics get it a lot because of the high levels of sugar in the urine, so that increases the infections. In any kind of infection, especially these kinds are in the tract of the urine. Most diabetics for women who do not wipe themselves properly. I have met many women. I had one elderly woman that was coming in almost monthly with a UTI, a urinary tract infection. And I had an idea, and I said, you know what? She was so simple. She came from the hills. She was a very simple person. And I said, how could you do anything? This lady's not wiping herself properly. And I said to the doctor, I have a feeling this patient. She goes, what do you mean by that? I said, just where she's coming from, the type of person she is, she's very, very simple. I said, I got a feeling she doesn't know how to wipe herself properly. And so I asked her. I said to her, how do you wipe yourself? So the doctor says, ask her. Go ahead, ask her for me. So I went, interpret for him. And I asked her, I said, how do you wipe yourself when you go urinate? And she goes, just like my mother taught me. She was cute. And I said, yeah, can you show me how? Like, which way? And she goes, yeah. I was like, I knew it. So we said to her, we of course did not say to her, that's not how it's done, because her mother taught her. I wasn't going to mess with mama. And, but we said to her, because you keep getting these infections, we're going to teach you a different way of wiping yourself. And so, I said, we're going to teach you a different way, and this way you didn't come back again. And it was so funny because the doctor, she had been seeing a urology a lot, and I work with him a lot. So, and he goes, every time I get somebody who has persistent UTIs, the first thing I ask, how do you wipe yourself? He goes, I picked that up from you. And I said, yeah, because some people, they come from, very simple places and they don't know. I mean, sometimes they learn right and sometimes they don't. So, and I've seen many people who don't know how to do it. So I have learned, and I learned my lesson. So it's like, sometimes you never know.
I know this woman just take her own antibiotic. She would take antibiotic from China.
Yeah, we
would
do
take it for a
too.
couple of days.
My mother too. But Mom used to come from Costa Rica on antibiotic, diuretics, this, and I'm like, Mommy, the doctor gave you all these things? No, I went to the pharmacy and bought it because I need it. Oh, okay, Mommy. We're famous for that because in our countries you can get it without prescription. My mom had all sorts of diseases.